Okay, so good afternoon, everyone. It's my pleasure to welcome you all to this wonderful webinar today. We have Tom Warner with us, who is going to speak on long-term care, COVID-19, and 2S-LGBTQ seniors. We're very happy to let you know that this is part of a series. So on February the 1st, we're actually going to have the French version of this webinar with Carmen Paquette and Olivier Lechapt in partnership with FARFO. Today's webinar is in partnership with Senior Pride Network. All attendees are being muted during this webinar, and we will be recording and posting the slide deck as well as the recording on this website, our website, www.eaton.ca. Big thanks to our sign language interpreters. We have two today, Andrea Lambert and Chris Chirelli. I have spotlighted Andrea, so you should be able to see her next to the speaker, and we'll do the same when Chris takes over. Questions should be put into the Q&A box, and the chat box can be used to post your comments and insights. And Mary Shakuri, my colleague here, who you can see, she is going to manage the chat box. After the session, you will get an automatic evaluation survey, and we really would like you to fill that out so that we can improve on our webinars. Elder Abuse Prevention Ontario endeavors to honor the land and its treaties by strengthening our relationship and responsibilities to them. We acknowledge that we live and work on Métis, Anishinaabe, Ojibwe, and Cree territories. We know that the presence of settlers, including myself, is not neutral. It has had and continues to have devastating impacts on many aspects of life for Indigenous peoples. Many of our practices, including the way we care for elders, the way we educate, came through these lands through the process of colonialism. I and we hold a new understanding of these interactions and engagement with the land and its peoples. Those of us who are settlers, myself included, we acknowledge that the way that we do things and our priorities may not be the priorities as we work toward a safe Ontario for all seniors. So I'm Christine Chan. I work for Elder Abuse Prevention Ontario alongside with my colleague Mary Shakuri, and we are delighted to introduce to you Tom Warner, who is Principal Spokesperson from Ontario Senior Pride. Tom's been an activist for queer liberation and rights for nearly 50 years. He was the founding member of the Zodiac Friendship Society, Saskatoon, and of the Gay Students Alliance at the University of Saskatchewan in 1971 to 1972. He's been active in a number of queer activist groups over that time and is primarily known for his involvement with the Coalition for Lesbian and Gay Rights in Ontario from 1975 to 2009. Tom was a leader of political action campaigns to have sexual orientation included as a prohibited ground of discrimination in the Ontario Human Rights Code during the 70s and 80s. And he was also instrumental in amending Ontario's laws to extend legal recognition to same-sex spousal relationships during the 1990s. Tom has served as an Ontario Human Rights Commissioner in the 1990s. He is the author of two books, Losing Control, Canada's Social Conservatives in the Age of Rights, and Never Going Back, A History of Queer Activism in Canada. Today, Tom advocates on issues important to 2S-LGBTQ seniors and older persons through his involvement with the Senior Pride Network of Toronto, and he's also a member of the board at the Advocacy Center for the Elderly. He's currently a member of the 519's Board of Management. Professionally, he's held regulatory and senior executive positions with the Institute of Chartered Accountants of Ontario and Chartered Professional Accountants of Ontario from 1980 until his retirement in 2016. Welcome, Tom, and please feel free to share your screen.
Okay, so I'm going to share the screen. Here we go. I'm hoping. Here we go. There we go. Okay, so thank you, Christine, and thank you all for being here, participating for this webinar today. As Christine and the information sent out has indicated, I'm going to be talking about the long-term care system in Ontario, COVID-19, and 2S-LGBTQ plus seniors, and in particular, some recommendations or a call to action that Ontario Senior Pride has made to the Long-Term Care COVID-19 Commission and to the Ontario government. And also, I should add recommendations that could be adopted by all the long-term care homes in Ontario without having to have a legislative mandate or a regulatory mandate to do so. The members of our ad hoc coalition are from across the province, Aging with Pride in Waterloo, the New Horizons 2S-LGBTQ plus seniors program in North Bay, which also has chapters in Barrie and Sudbury, Ontario. The Ottawa Senior Pride Network, Senior Pride Network Niagara, Senior Pride Network Toronto, Rainbow Faith and Freedom, and Windsor Pride Community. Our objective in making the submission and recommendations to the Commission is to ensure that Ontario's long-term care system is inclusive, respectful, and welcoming of 2S-LGBTQ plus seniors, and recognizes and positively responds to our particular health care and social and emotional needs and concerns. This is essential at all times, and especially during pandemics such as COVID-19. Our submission recognizes that the long-term care system tragically fails to uphold the fundamental principle of the Long-Term Care Homes Act 2007, that a long-term care home is primarily the home of its residents and is to be operated accordingly. And that the COVID-19 pandemic has negatively impacted Ontario's 2S-LGBTQ plus seniors and highlighted many long-standing issues, inequities, and failures within the system. And also that there is a pressing need to integrate 2S-LGBTQ plus inclusivity and respect for 2S-LGBTQ seniors in the long-term care system. Our submission to the Commission recognizes that 2S-LGBTQ plus seniors are residents of long-term care homes, that 2S-LGBTQ plus persons are also employees and volunteers in long-term care homes, and that we are the spouses or partners of long-term care residents and our family members and caregivers ourselves. Our submission also recognizes that 2S-LGBTQ plus seniors are generally invisible in long-term care homes in Ontario, and I would say throughout the country, Canada. Ontario's long-term care system was failing 2S-LGBTQ plus seniors long before COVID-19 came about. And importantly, that data are not available on the number of 2S-LGBTQ plus seniors who are residents of long-term care homes in Ontario, or who contracted COVID-19, or those who died after contracting COVID-19. We also sort of make the point in our submission that the long-term care system in general has been neglectful of or unresponsive to the particular needs and concerns of 2S-LGBTQ plus residents. And that during COVID-19 outbreaks in the long-term care homes, there has been even less awareness of or attention given to the particular needs and concerns of 2S-LGBTQ plus residents. We have an extensive section in our submission to the Commission dealing with the chronic health conditions and COVID-19 as they relate or have affected 2S-LGBTQ plus seniors. In general, there's a lack of awareness on the part of long-term care staff about the particular health and social factors that make 2S-LGBTQ plus seniors more vulnerable to contracting COVID-19 and that put them at greater risk of dying from the virus. And in particular, the measures adopted in response to COVID-19 outbreaks fail to acknowledge and address the particular health issues and the diverse life and aging experiences of 2S-LGBTQ seniors. There is some data that is available generally for 2S-LGBTQ plus people in Canada and in regard to COVID-19. A national survey on the impact of COVID-19 found that 2S-LGBTQ plus people are more vulnerable to COVID-19 than are other persons. 29% of those surveyed are living with a chronic health condition, compared with 15% of other people in Canada. And 21% of those 2S-LGBTQ plus respondents who identify as Black, Indigenous, and people of color have been admitted to the hospital for COVID-19, compared to 9% of both 2S-LGBTQ people in general and the national population. Many research studies, the survey also indicated that 2S-LGBTQ plus communities have reported greater current and expected impacts of COVID-19 on their physical and mental health and overall quality of life than is the case for other people. And also 2S-LGBTQ people, especially those who identify as BIPOC, are more likely than the general population to know somebody who has died from COVID-19. Research data show that there's a greater prevalence of cardiovascular diseases, diabetes, cancer, HIV, and respiratory diseases among 2S-LGBTQ plus people. A higher percentage of lesbians and bisexual women have asthma, 16% than other women at 9%. And that HIV positive 2S-LGBTQ plus seniors are now at high risk for HIV/AIDS related comorbidities, such as cardiovascular disease, diabetes, kidney disease, cancer, and osteoporosis. We do stress in our submission that imposing social distancing in response to COVID-19 can negatively impact the mental, social, sexual, and physical health of self-identified 2S-LGBTQ plus residents, and even those who are straight identified seniors who have had same-sex encounters. And that's because there are higher rates of mental health challenges such as anxiety, depression, and loneliness. In general, the various protocols and procedures put in place in long-term care homes for responding to COVID-19 do not consider the particular vulnerabilities and special needs of those who are 2S-LGBTQ plus seniors. The multiple and interrelated health issues and particular care needs of 2S-LGBTQ plus seniors should have been taken into account, in our view, in planning and implementing measures to effectively respond to COVID-19. And importantly, they must now be taken into account when combating future pandemics or infectious disease outbreaks in Ontario long-term care homes. So the first set of recommendations that we have set out in our submission to the Commission and to the Ontario government is that the Ontario government should provide ongoing funding to support the collection of demographic data on 2S-LGBTQ+ seniors and residents of long-term care homes, 2S-LGBTQ+ residents of long-term care homes, and to provide funding to conduct research on the specific concerns and needs of and support systems required for 2S-LGBTQ+ seniors in general, and the service offered in particular to 2S-LGBTQ+ seniors in long-term care homes during the COVID-19 pandemic. There are a number of particular issues, systemic issues in the long-term care home system that have been present for a long time that we have argued, we've submitted in our submission, have been highlighted or heightened, perhaps made worse as a result of COVID-19 and the various measures and protocols and particularly restrictions that have been put in place in long-term care homes to respond to combat the outbreak of COVID-19 in those homes. 2S-LGBTQ+ seniors may experience or have a fear of experiencing discrimination, harassment, and abuse from residents and staff in long-term care homes. They have fears about how they will be treated in long-term care homes, and those fears are heightened and intensified during COVID-19 outbreaks. And they're generally more vulnerable and more at risk of discrimination, harassment, and abuse during pandemic outbreaks and less able to report or seek assistance. There is a perception that long-term care homes' approaches to care are based on assumptions that everyone is heterosexual and that heterosexual norms and social interactions are applicable to and appropriate for everyone. There is also a presumption evidenced in long-term care homes that gender identity and gender expression equate with the sex or gender assigned at birth, and misgendering of residents through such actions as refusal or unwillingness of staff to use residents' chosen or preferred pronouns are prevalent. Long-term care homes also may refuse to place transgender residents in rooms or wards that match their gender identity and may deliberately misgender them. A study done by the Ottawa Senior Pride Network in 2015 cited the fear of discrimination, harassment, and abuse as one of the biggest issues for 2S-LGBTQ+ seniors when considering whether or not to become residents of long-term care homes. And a majority of the respondents, 82% in fact, said that they would really prefer to stay in their homes, but they will do anything to avoid going into a retirement community or an extended care facility. To avoid discrimination and prevent rejection, being ostracized or neglect, 2S-LGBTQ+ residents may conceal that they are intersex or will not disclose their sexual orientation, gender expression, or gender identity. There's a fear of having to go back into the closet if they've been living out of the closet all their lives or most of their lives. This can result, these fears about being discriminated or being rejected or neglected result in feelings of isolation, loneliness, anxiety, and can negatively affect the quality of care provided. And there have been some research studies that have indicated that having to hide or feeling that you have to hide or not disclose your gender identity or your sexual orientation does have a negative impact both on the nature of care provided and the quality of the care provided to residents of long-term care homes. As one administrator in a long-term care home has told us, who was himself a gay man, but was not sort of generally out within the long-term care home or the community, but had been an administrator in long-term care homes for about 30 years, told us that in all of that time, there had never been a resident of a long-term care home who had come out as or had identified as LGBTQ, although it later became apparent through private conversations or through their visitors and others that they were. What he has said is that and this is a quote, long-term care is frightening to people who are different. When you are at your most vulnerable and you are most dependent upon others for your basic care, it is sad that people fear the judgment of those who give care and so hide themselves as a form of self-preservation. That's the end of his quote. Sort of in general, long-term care homes, in our experience and our observations, do not have policies, practices, and procedures that invite or encourage seniors to disclose our sex, whether we identify as intersex, sexual orientation, gender identity, or gender expression at initial intake or assessment, and in a way that is safe, welcoming, and confidential. They also generally do not take proactive measures to visibly convey to residents and visitors that they are welcoming, safe, and inclusive spaces for 2S-LGBTQ seniors to live in. And recently, during the time of the pandemic and during periods of outbreaks of COVID-19 in long-term care homes, we have learned, some of our member groups have learned that long-term care homes in one city in the province have even refused to allow them to put up flyers and information or business cards with information about the services that are available to 2S-LGBTQ plus residents. And the reason cited for that is that the staff in the long-term care homes themselves would not be comfortable with having that kind of information available in the homes. So our next recommendation that we've made to the Commission and to the government is that long-term care homes should be required to adopt equity, inclusion, non-discrimination, anti-harassment, and protection of person policies that specifically include sex, sexual orientation, gender identity, and gender expression. And also that long-term care homes should be required to designate 2S-LGBTQ plus advocate staff role, a staff role in the long-term care home. Residents should be able to report to this staff advocate any feelings about being excluded, disrespected, or mistreated, concerns that they may have about the nature and the quality of their care or their living conditions, or disputes involving staff or other residents. The advocate should have specific senior level 2S-LGBTQ plus diversity training, with an understanding that a 2S-LGBTQ plus resident may also be, for example, Black, Indigenous, or a person of color suffering from other forms of discrimination. One of the other issues that we address in our submission and in our recommendations is in regard to spiritual care for 2S-LGBTQ plus residents. The long-term care system in Ontario generally is limited in its provision of optional and inclusive faith-based programming that recognizes the diversity of its residents, staff, and other service providers. Many 2S-LGBTQ+ seniors have had personal experiences with religious-based discrimination and are less likely to have accepting blood relatives to support them in personal times of crisis and end-of-life situations.
This is just a gentle reminder to let you know that you're at the halfway point. You're doing well. Just we're at the halfway point.
Yes,
thank you.
Thank you. So we have some recommendations in regard to ensuring inclusive faith-based programming in long-term care homes. Long-term care homes should be required to implement a mandate to ensure all faith-based programming recognizes the diversity of its residents, staff, and service providers. The programming should be inclusive, regardless of an individual's sex, gender identity, gender expression, or sexual orientation. The long-term care home should also ensure that all residents feel comfortable practicing their spiritual rituals and are provided with the appropriate services and resources to be able to do so. And to ensure that staff working in long-term care homes are trained and educated on how to intervene when faith-based discrimination has occurred or when faith-based programming fails to use inclusive frameworks in their programming. One of the long-standing issues in long-term care homes has been that the staff who spend most of the time with residents, with few exceptions, are untrained, little trained, or ill trained in 2S-LGBTQ+ care issues and needs, or are indifferent to or lack awareness of them. This causes anxiety for 2S-LGBTQ+ residents about healthcare aides who assist with daily life activities. Also, staff may not be comfortable, in many cases are not comfortable with 2S-LGBTQ+ residences or have biases or negative attitudes, including homophobia, transphobia, and biphobia. And often staff behaviors and actions are motivated by judgmental or condemnatory religious beliefs. And Jane, just a short story. Again, the man who was the administrator in the long-term care homes tells the story of two women, two lesbians, although it wasn't immediately known, two lesbians who were residents of a long-term care home in Ontario, who had lived together for over 40 years in a spousal relationship, and in fact had been married to two gay men and passed in their communities as being two sisters and two brothers who happened to marry, form a family, and live together. But when they came to, when the two women became residents of long-term care homes, they of course were separated. They had separate rooms, but they did spend all their time together. They offered support to each other. They took care of each other. And as it turns out, they started sleeping together. So one woman would come from her room into the other woman's room. And when the staff discovered this, they immediately took action to keep the women separated at night, prevent them from being able to sleep together. And the reason given for that was that they didn't think it was appropriate that two lesbians should be sleeping together, sharing a bed together in a long-term care home. So these are the kinds of incidents that can and do unfortunately happen within the long-term care home system in Ontario. Because of the concerns of 2S-LGBTQ+ residents about long-term care staff, the nature and quality of care provided to these residents during the COVID-19 pandemic is further negatively impacted. Also, 2S-LGBTQ plus staff are too often made to feel invisible, are not acknowledged, are not supported, or are not equitably treated within Ontario's long-term care homes. Two LGBTQ plus residents themselves say that their long-term care home would be more welcoming and inclusive if staff are open and affirming about their own 2S LGBTQ plus identities. Yet many 2S LGBTQ plus staff choose not to disclose their identities because they are worried about or have a fear of experiencing discrimination and harassment from residents or the family members of residents or other caregivers and from other staff. So one of the other recommendations we've made to the Commission is that the Ontario government develop and implement inclusive policies and practices for long-term care service providers that recognize the diversity of 2S LGBTQ plus seniors and their social determinants of health and the particular service and care needs of those seniors. The government should also invest in establishing and maintaining a train-the-trainer program to train the instructors or facilitators of 2S LGBTQ plus seniors sensitivity, inclusion, and cultural competency training for staff in long-term care homes. The Ontario government should also require every long-term care home to provide compulsory 2S LGBTQ plus seniors sensitivity, inclusion, and cultural competency training for all full-time, part-time, and contracted or agency staff, and for volunteers. Staff in all departments in long-term care homes should be full-time staff with strict short-term limits on the length of time a long-term care home may employ any part-time or agency staff instead of full-time staff. And long-term care homes should be required to ensure that they are positive, welcoming, safe, and inclusive work environments for 2S LGBTQ plus staff, caregivers, and volunteers. One of the long-standing issues that's been particularly highlighted by outbreaks of COVID-19 in long-term care homes is social and physical isolation of 2S LGBTQ plus seniors. In general, 2S LGBTQ plus seniors experience social isolation often throughout their lives and before they become residents of long-term care homes. It is unfortunately the case that in most communities in Ontario, there are not services or programs available to 2S LGBTQ plus seniors to assist them in living in their communities and to stay connected with broadly the queer, trans, two-spirit communities in their areas or in their regions. Social isolation and lack of emotional and social support systems negatively impact the health and well-being of 2S LGBTQ plus seniors in general and in particular for those who are residents of long-term care homes. The COVID-19 outbreaks in long-term care homes have caused even greater social isolation for 2S LGBTQ plus residents because of the strict social distancing protocols and restrictions on visitors, which is causing greater loneliness, depression, despair, and a deterioration in their physical health and general well-being. Some of the reasons for the social isolation and sort of the lack of connectedness with community are that 2S LGBTQ plus seniors are less likely than other persons to be in a spousal relationship to be widowed or to have children, and may lack adequate social and emotional support as a result of that. To reduce social to reduce social isolation and build personal support networks, 2S-LGBTQ+ seniors increasingly are relying on chosen families, surrogate families or non-biological families, or a circle of friends, a support system, a support network that might include partners, close friends, other caregivers. Excuse me. Unfortunately, it is the case often in long-term care homes that spousal relationships, chosen or non-biological families, or non-conforming relationships are not recognized or are not respected by the long-term care home. Visitation restrictions, particularly those imposed in response to COVID-19, reflect the lack of respect for 2S-LGBTQ+ family dynamics, often by restricting visitors to blood relatives or those who hold a power of attorney only. And we know that this is it's still happening in long-term care homes in Ontario. We've had some recent examples of that. For many 2S-LGBTQ+ seniors, their biggest fear is dying alone and forgotten, as it is for many seniors. Unfortunately, it is the case that they can become doubly isolated as a result of COVID-19, and their biggest fear can become a reality. And we know certainly there's been one case that we are aware of in Toronto in a long-term care home of a gay man who was, I believe, 85 years old. While he did not die from COVID-19, he was in a long-term care home when there was an outbreak of COVID-19 in the home, and was left isolated, was not cared for, was not allowed any visitors, including members of his chosen family, and we believe died as a result of being neglected and dying of loneliness and being forgotten. To mitigate social isolation and provide emotional and social support for 2S-LGBTQ+ seniors, the Ontario government should require long-term care homes to recognize and respect 2S-LGBTQ+ spousal relationships and chosen non-biological family members for visitation and for providing essential care to 2S-LGBTQ+ residents. The final area or issue that I'll address in this presentation is resident-centered care for Ontario's long-term care system. Many organizations have called for resident-centered care models in the long-term care system over many years, and the government itself, the Ministry of Long-Term Care, has indicated that it wants to see a resident-centered model of care in long-term care homes, but that really has not yet come into fruition, at least in across the system. So we are calling in particular for this model because we believe that it focuses on the individual resident and their holistic well-being rather than just a series of tasks or medical conditions. It's rooted in fundamental concepts that include self-determination, agency, and empowerment of residents of long-term care homes in regard to making decisions and choices about their own health, well-being, and care needs. We believe that the resident-centered care model would respond to the complexities of providing care for diverse residents of long-term care homes. It would provide more personally tailored care for long-term care home residents and improve their social environment, quality of care, quality of life, and emotional and psychological wellness. And it would address the diversity, life experiences, and social determinants of health that impact 2S-LGBTQ plus seniors' physical and mental health, and that influence their needs and concerns when in long-term care. The residence-centered care model would also, though, require viewing and treating the person for whom care is provided as a resident of a home and not as a client or a patient. And it would include adopting a cultural sensitivity approach to better meet the needs of racialized 2S-LGBTQ plus seniors and Two-Spirit elders. And finally, a resident-centered model of care also should be supported, in our view, by amendments of the Residents' Bill of Rights in the Long-Term Care Homes Act to align more closely with the prohibited grounds of discrimination in the Ontario Human Rights Code by including sex, sexual orientation, gender identity, and gender expression. And the final set of recommendations that we've made to the Commission and to the government are, as I've indicated, every long-term care home in Ontario should be required to adopt a resident-centered model of care that is consistent with the fundamental principle of the Long-Term Care Homes Act. The resident-centered model should be tailored to positively respond to the unique issues, needs, and concerns of diverse 2S-LGBTQ plus seniors. And finally, the Residents' Bill of Rights in the Long-Term Care Home Act should be amended, as I say, to align more closely with the prohibited grounds of discrimination in the Human Rights Code by inclusion of sex, sexual orientation, gender identity, and gender expression. So in conclusion, as I indicated at the beginning, our objective, the objective of the organizations that have made this submission to the Long-Term Care COVID-19 Commission and to the Ontario government, and by extension to long-term care homes themselves, is to ensure that Ontario's long-term care system is inclusive, respectful, and welcoming of 2S-LGBTQ plus seniors, and recognizes and positively responds to their particular health, care, and social and emotional needs and concerns. This is essential at all times, and especially during pandemics such as COVID-19. If implemented, our recommendations would better prepare Ontario's long-term care homes to provide the adequate care to 2S-LGBTQ plus seniors that they deserve, and that is their right to expect and to receive under the Long-Term Care Homes Act 2007 and the Ontario Human Rights Code. So that concludes my presentation. I hope that you have found it to be interesting and informative, and I'm happy to take any questions or hear any comments from anybody about anything that's been talked about.
Great. Thank you, Tom. Thank you so much. There's been so many positive comments in the chat. So many people have just said a big thank you and wonderful information, and are very excited to actually rewatch it again on the webinar that, as I let everybody know, we are recording and will be available in a few days at eapon.ca. So I'll get into some questions for you that have come up through our Q&A box. First question is, we've been asked if you know about the rates of substance use disorders in the 2S LGBT plus community, plus older adult population, and rates in the 2S LGBTQ plus in long-term care.
So, I'm sorry, I didn't catch the first part of the question.
So asking about the rates of substance use disorders. So looking at I think at the two different settings, so at the communities not living in LTC versus living in LTC with substance disorders.
Right. There have been a number of research studies done generally for 2S-LGBTQ communities and populations. I'm not aware that there has been any in regard to 2S-LGBTQ plus seniors, or specifically those who are residents in long-term care homes. So that is one area where there certainly is a need for some research to be done and for some data to be obtained.
Perfect, thank you. And another question is, Tom, do you have any stats of disabled seniors who are affected by COVID and experience discrimination, abuse during this time?
I'm not aware, and we're not aware. And one of the challenges that we've had is actually learning about or hearing about the actual experiences and stories of 2S-LGBTQ plus residents in long-term care homes. For a lot of the reasons that I addressed in the presentation, in terms of, and many of the long-term care homes say they don't have any 2S-LGBTQ plus residents at all, and we don't have any information as to who they are. So no, unfortunately, I don't have any information on that.
Great, thank you. We have sort of a comment question where Julia had said, inspectors and independent federal and provincial ombudsman persons funding is important. Do you see this as an important means to enhance care for such residents? OHC is asking this for all LTC now.
Yes, I would see it, but I would add that the inspections themselves, we would argue, should also be looking at or investigating both the quality and the nature of the specific services being provided to 2S-LGBTQ plus residents of long-term care homes, and some of the issues that we identified in terms of, do they have policies and procedures to ensure, equitable treatment, non-discrimination, how do we deal with abuse and neglect, and in particular, any particular issues or concerns or instances that there may be, complaints that there may be involving 2S-LGBTQ plus residents of long-term care homes.
Excellent, thank you. Another question is your thoughts on PSWs. Should they be regulated, better educated, better paid? So just wanting, I guess, some of your thoughts and opinions on our current state with PSWs.
I'd say yes to all of that. Yes, they should be regulated. Yes, they should be better educated. Yes, they should be better paid. Yes, their working environments need to be significantly improved. In particular, there is no required or mandatory education or training program in order to qualify to be a PSW, at least that we're aware of. I know that there are programs that are available through some community colleges and private colleges, but quite frankly, it's very minimal in terms of both the subject matter of the content covered and the number of hours of instruction. So yes, yes to all of that, most definitely. It's essential that there will not be any significant improvement in long-term care homes unless all of those are implemented and immediately.
Perfect, thank you. Again, a bit of a comment and question from one of our attendees is saying, understand that COVID-19 has exposed significant weaknesses in the LTC system, there are many, agree that LTC homes are homes first and they are resident care centric. Their resident care centric is critical. Has there been any effort to create 2S-LGBTQ plus LTC specific facilities in Ontario, residents and staff? And again, saying agree that there should be more specific research to understand the circumstances of the 2S-LGBTQ plus community, plus in LTC, and in particular with respect to COVID-19, are you aware of anyone undertaking this research right now?
I'll deal with the second part first on research. There has not been, up till now, a lot of research, but thankfully there is now beginning to be. I know that there are 2 or 3 studies underway, research projects underway through some academics at some of the universities now. So I'm expecting that before too long, we will start to have some of that data and some of that information. So that's good. In terms of the first part, which I've now forgotten, the first part of the question was on, homes, whether there are any specific. No, there are not at the moment. And you know, it's a challenging question, but you might say that, say in Toronto, which is a large city and has a very large and very diverse 2S-LGBT community, it might make sense, it might be feasible to have a long-term care home that was specifically designated for queer, trans, and two-spirit seniors and elders. But I'm not sure. And you know, the Rakai Centers in Toronto is now looking at not a dedicated long-term care home, but certainly dedicated space within one of their homes that would be specifically for 2S-LGBTQ plus seniors. But in other communities, would it be feasible? Would it make sense? I'm not sure that it would. Probably what would be good, and there are different opinions even among our seniors in our community as to which is the best approach to take, but it probably would make sense and be very desirable to have some dedicated space, or at least if it's known that there are residents who identify as 2S-LGBTQ, to put them together or in close proximity in the same part where they can provide support and interact with each other and those sorts of things. So maybe a dedicated floor or a dedicated space as opposed to an actual home that is specifically 2S-LGBTQ plus. And others, and a lot of our seniors say they don't really want to live in what they basically would see as a bit of a ghetto within the long-term care home as well. So there's that consideration. So I'm not sure that there's a right answer to that, but I don't think that one approach fits all situations or all communities.
Definitely. Thank you. We have, again, a lovely comment from Cheryl to thank you on the presentation and all the recommendations which you've captured and challenges and disparities of our long-term home care system and staff. She's asking, have these recommendations been submitted to the Commission and other appropriate bodies? If so, what is the timeline for the responses as well as the follow-up? And just wishing everybody safety, proper care, and respect to all. Thank you, Cheryl.
Okay. Well, we have we've made a very detailed written submission to the COVID-19 Commission. I'm also pleased to say that we also were able to make a presentation to the commissioners last month, in which we were able to present our issues and concerns and our recommendations to them. What results from that remains to be seen, but at least we have had the opportunity to present to the commissioners all of our recommendations for the system. We've also made our submission and recommendations available to various cabinet ministers, the Minister of Long-Term Care, Minister of Health, Minister for Seniors and Accessibility, and some others, and their parliamentary assistants, and to the various opposition members and critics, and to some other advocacy and stakeholder organizations in long-term care. So we're doing our best to try and sort of get the word out there and get our recommendations out there and advocate in support of them. But we'll need to wait and see in terms of the commission itself. They are due to report in April. So we'll wait optimistically to see to what extent they may have agreed to at least acknowledge some of the issues that we've identified, if not actually adopt some of our recommendations.
Of course. And just in the interest of time, this may be our last question, but we'll make sure for all the questions that have been submitted, we will make sure they are sent to Mr. Warner, and we will get a response back to everybody. So a question about any success stories in our 2S-LGBTQ residents in long-term care. Do you think it would help change the narrative to amplify these experiences of any of these success stories that have happened, or are there any to share?
Well, there are some for sure, not as many as we would like to be able to know about or to tell. I mean, I do cite the Rakai Centers in Toronto as an example of one of the long-term care homes that has sort of proactively adopted policies and procedures and has provided programming and services specifically for 2S-LGBTQ+ seniors, and have done some really good work that way within their homes and within the communities. Also, the City of Toronto has adopted policies and has had a really good toolkit, specifically focused on providing care and services for 2S-LGBTQ+ residents of their long-term care homes, which I would recommend to anyone who's interested in knowing about that, and has had some training, cultural competency training programs, and they're now looking at a new model. They call it an emotion-centered care model, but it's really kind of like the resident-centered care model. And we're working with them on a pilot project in terms of the development of training materials and toolkits and that sort of thing for staff in those homes. So there are some good things that are happening out there. I know there's I can't remember the name now, but there's a long-term care home in Ottawa that we know is just excellent in terms of being welcoming and inclusive of 2S-LGBTQ+ seniors and being connected with the community in Ottawa. So there are some, yes. Unfortunately, there's not as many as there should be.
Perfect. Thank you, Tom. And again, on behalf of myself and our entire team at Elder Abuse Prevention Ontario, this webinar has received so much wonderful praise, so much great questions have come through. We'll make sure we get them all to you. And it is really showing that our attendees today really care what's happening to our residents in Ontario, and we're all behind you to make positive and encouraging changes. So thank you so much, Tom, and I'll hand it over to my colleague, Christine, now. Thank you.
Thank you.
Thank you so much, Tom. I'm looking forward to better days and better policy decisions. Just wanted to let the participants know that we have some pretty exciting webinars ahead. You can see on my screen on January the 28th, we have Making Justice Accessible for Older Adults. And we have 2 exciting speakers from Victim Witness Assistance Program. And then we have February 4th, we've got Consent Capacity in the COVID Context. And we have a capacity assessor speaking. She's Shona. She's also an OT. And then February 11th, we're speaking about sexual violence among older adults. And the speaker actually is Lynn Cohen from the Durham Rape Crisis Center. Jeremy Bertrand from the Ministry of Finance is speaking on February the 23rd on understanding Ontario's personal income tax credits and benefits during the pandemic. Who doesn't need to go to that one? And Jeremy is wonderful with making it a lively session, even though it's about finance and tax. So make sure that you sign up. Tom, thank you so much for your time. Thank you so much for your thoughtful analysis and recommendations. We hope they will be successful. And thank you, Chris and Andrea, from our sign language interpreters. We really appreciate your assistance. So thank you, participants. We love your comments. We will be sharing all of them with Tom, as well as the Q&As. The ones that we didn't get through, we will still send to Tom.
Most
Thank
definitely.
you.
Thank you, everybody. Have a great afternoon. Thank you.
Thank you.